Warriors around, don't get caught in the mosh pit. Fuel to the fire, ain't nobody can stop it. Trouble in my city, but you know I'm across it. Got a 40 on my hip and I'm liable to spark it. Throw down these hits, my click is indivisible. I aim, you duck, I squeeze, now you invisible. I'm not afraid of getting physical. All these different chemicals are fogging up my visuals. Bloods on my hands, got slugs on my gunners. Yo, we notorious, we ain't no runners. Bloods on my hands, got slugs on my gunners. Yo, we some warriors, they ain't called gunners. Bloods on my hands, got slugs on my gunners. Bloods on my hands, got slugs on my gunners. Put on my sweat, put on the beat, put on the map, put on my team. Take out every motherfucker in between, know what I mean? Better myself, better my aim, better my rap, better my name. Killing rappers on my hang, I'm by the chains for the fame. Never thought I would it, now I'm running. You don't wanna follow me, now I'm looking for.
What's going on? What's going on? I'm back. Good evening, everyone. Welcome to a brand new episode of Steve the Kidney Nurse. I am your host, Steve Belcher. Thank you for joining. Look, share this broadcast, guys. Please share this broadcast. This is one show you definitely want to share with your friends, your neighbors, your loved ones, especially if they're at risk for heart disease or have heart disease, at risk for kidney disease, or have kidney disease. The heart-kidney connection is very important to know about. And so this broadcast tonight is dedicated to the heart-kidney connection. Now, before we start our show, I have to tell you, unfortunately, we are not able to have Kelsey Reed, owner and licensed renal dietitian of CKD Nutrition. She fell ill at the last minute. We send our prayers and hope for a speedy recovery, and we will have her on another show where we will talk about proper nutrition around heart disease and kidney disease. So tonight we have Dr. Anteye Medical and Clinical Director of Kibo Bio Health, to tell us and talk to us about the heart-kidney connection. Now, before I bring Dr. Ntaye on, heart disease is very common in people with kidney disease or kidney failure. And in fact, it is the leading cause of death in people with kidney failure. That's why this topic is so important. So without further ado, I'm going to give the doc the VIP treatment. We haven't done this show in a very long time. And we have certain introductions. So without further ado, Dr. Ntaye. Hi, Dr. Ntaye. How you doing? I can't hear you. I can't hear you, Doc. If you can hear me, can you sign out and sign back in? Okay, while we wait for Dr. Ntaye to sign back in, again, as I mentioned, heart disease is commonly seen in dialysis patients. All right, I talked about this yesterday in a brief conversation on TikTok about heart disease and kidney dialysis. Now, we're going to talk about heart disease, not just it impacting kidney patients, but how it can impact you if you're at risk for heart disease or if you have heart disease, not just kidney disease or kidney failure. And also, I'd like to thank our sponsor tonight, Kibo Biotech. Let me bring Dr. Ntaye back on. I think we have him. Hi, Doc.
Yeah, I can hear you.
There we go. Thank you. Thank you. Thank you for joining the show, Dr. Ntaye. I really appreciate you taking the time out of your schedule to come on and talk about the heart-kidney connection. Doc, can you just share a little brief bio of your experience with Kibo Biotech?
Thank you, Steve, for having me on tonight's show. And thank you, folks out there and who were able to join us tonight. My name is Emmanuel Ntaye. I'm the clinical medical director of Kibo. And before now, I've been a practicing nephrologist professor, as well as clinical researcher on kidney diseases. And I have experience in managing chronic kidney diseases, both in many parts of the world, most especially with the African setting. And currently I'm with Kibo, directing the clinical development programs of Kibo. And our focus is mainly on chronic kidney diseases in intervention and how to reduce the progression of CKD in patients who have chronic kidney disease. And Kibo, as you all know very well, has been in the kidney space for over 25 years, researching into products that can, reduce the progression of kidney disease. And currently we have 2 programs ongoing, especially clinical trials involving people in advanced CKD stage 4 with a probiotic formulation, which, with FDA approval, intervening in people with CKD to reduce their progression. And very soon, we
Wow.
are also starting another clinical trial in people who are on dialysis. And so Kibo has been involved in the CKD and kidney health space for over 25 years. And we have been involved in also in health education, promotion of kidney health. And now, of course, we are now into uh, intervention in the chronic kidney disease spectrum.
Okay. Now, Dr. Nteya, can you briefly describe to us um, heart disease and kidney disease?
Yeah, thank you very much, Steve. First of all, what is kidney disease? As we all know, just to let viewers know that where your kidneys are, they are just 2 organs at the back of just at the back, towards the back of your tummy. And these organs, not very big, but very important to the body. And it filters the waste products, produces important hormones and substances that keep life going, regulates your water and also your blood pressure. And so when these functions are impaired, of course, the kidney disease, especially when they are damaged, then they cannot filter blood as they should. This damage can cause waste to build up in the body. For most people, kidney damage occurs slowly over many years. This gradual loss of kidney function is called chronic kidney disease. Most patients with chronic kidney disease have no symptoms until the kidney damage is advanced. After many years, you may start to feel sick or tired all of the time. But if it continues and advances into kidney failure, that's when you will now need a kidney replacement therapy, which either by a transplant or by dialysis. But before you reach that stage, other health problems may develop. One of these problems is the heart disease. And so this brings us to now what is heart disease? Heart disease includes any problem that prevents your heart from pumping blood as well as it should be. And the problem is starting with your blood vessels or your heart itself. When we talk of blood and the heart and the blood vessels, this include also substances building on the walls of your blood vessels, as well as blood clot that blocks the flow of blood to the heart, and may also involve heart attack, and that includes heart damage that is caused by lack of blood and oxygen to the heart. And this buildup of plaque, blockage, and other thing will create a lot of problems to the heart. And the early symptoms that may develop are pain in your chest, which is called angina, pain in your legs when walking, sudden numbness or weakness in your arms or legs. You could have temporary signs of stroke. And of course, the blood clot may also form in vessels that carry blood to the heart muscle itself. So each person may have different types of heart attack symptoms or signs. But usually the chest pains or discomfort often will cause some chest pressure in the person. So by and large, the kidney can cause heart disease, and heart disease can cause the kidney, because these 2 organs, as we know, are so much interrelated, connected by blood vessels. And the heart, once you pump blood and the oxygen, 25% of it goes to the kidneys. And so when the heart function is impaired and this blood cannot reach the kidneys, of course, the kidney function also becomes impaired. And in attempts to increase the blood flow, there are certain, you know, processes that take place, and that again also affects the heart. So you can say it's a vicious cycle. So by the time you develop heart disease, kidney disease, they also get worsened or initiated. And once kidney disease progresses, of course, the heart also becomes affected and progresses. So there's this unholy alliance of these two organs, which they are. Secondly, the risk factors for heart disease and kidney disease are shared by these two organs. If you look at the risk for heart disease, hypertension, diabetes, is the same risk also for kidney disease. And so the commonest cause of chronic kidney disease, especially in the United States, is diabetes and followed by hypertension. And this also affects the kidney. So what I told you about how the heart disease evolved and caused this, these two organs share the same risk. So if you, and of course, those who smoke and those who, are not engaged in adequate physical activity, poor diet habits, obesity, and, high cholesterol levels, these are risks that are shared by these two organs. So in a nutshell, you know, what if you have this risk, so you are more prone to develop these diseases of these two organs. The third other issue again is that the when you develop the chronic kidney disease, you find out that the commonest cause of death among people with chronic kidney disease is the heart disease. And that's why it's very important to manage your kidney disease in early stages adequately, and also manage the risk factors so that you don't develop the heart disease that as part of complications of the chronic kidney disease.
Dr. Interior, for patients that are on dialysis, how important for them is it to manage their phosphorus and calcium? Because you hear a lot about calcification. I've heard of some patients tried to get a kidney transplant and they couldn't because they had calcification around their heart. Can you talk a little bit about how important it is to regulate and manage your phosphorus level and your calcium if you're undergoing kidney dialysis?
Yeah. When the chronic kidney disease occurs, there are some complications that usually ensues. And apart from the hypertension, anemia, one other things you see is the calcium and phosphates, disorder, which you see in them, because they don't have the ability to excrete phosphorus and phosphate, which usually they take in their diets. And this also affects also how calcium is also handled by the body. And once this is affected, the calcium get deposited on the vessels. And once they get deposited on the vessels, and that is what I call, plaque will develop. The vessels become stiff, become calcified. The lumen that carries the disease also narrowed, and so blood supply to vital organs will now be markedly reduced, either into the heart itself, in the coronaries, to vessels, to vital organs, also to the brain and other vital organs in the body. And so if you don't control this phosphorus, phosphate, and calcium, and manage them properly or treat them, of course, this is where you develop the atherosclerotic cardiovascular disease. And especially, these are one of the reasons why people who are on dialysis or in end-stage kidney failure, develop coronary artery disease, heart attacks, strokes, very common among them. And so the even to create fistula, which we use is a vascular access that you need for dialysis, even sometimes becomes a problem. And fistula failures are also very common among them if you don't control this. And so handling them is, first of all, diet is very vital. Is a starting point. Look at the phosphorus or phosphate content or rich foods, how you can cut it down. This you can work with a dietitian who work with you and see how he can modify your diet to help you so that you can reduce your phosphate rich foods and phosphate containing foods. And then of course you can control them with some medications which are also available, with phosphate binders, which you can also, they are available, and they help to control the phosphate levels in people with chronic kidney disease and people who are dialyzed.
Now, people who that may already be dealing with heart disease or kidney disease, and they may be watching this, is there anything that they could do to minimize the risk of further damage if they haven't already damaged their heart? Meaning, is there anything they could do to minimize the risk of further damage that they may have already caused if they have heart disease?
Yeah, well, the best approach is primary prevention. But if you have passed that stage of primary prevention, from what you are discussing, the damage is already there or the risk is already established, then we'll now look at secondary prevention or treating the underlying risk factors. I think one of the first things is, first of all, is to early detection of your heart disease and the chronic kidney disease at the stage where we are. Secondly, look at the modifiable risk that which you have, which you can treat, especially that probably cause your chronic kidney disease, diabetes, hypertension, which make sure that they are well controlled, have the right numbers of control, and the target which your primary care or your nephrologist, who is managing you, must have set for you. Mm-hmm. And so ensure that you control your diabetes, control your blood pressure, your cholesterol level. Then diet is also very important, and then it's also important to in controlling most of these risk factors and the complications which you have with chronic kidney disease, and medications that helps to reduce some of those complications, that which they are the main phosphate binders, they control of anemia, control medications to ensure that your glucose control is good, and then of course improve your lifestyle, which is very vital, very important. Then one of the other things is regular physician's review is also very important for them. And in most of the time, I usually advise that patients should work with their physicians and their caregivers, especially healthcare professionals that are looking after their various other components like endocrinologists and cardiologists and nephrologists for their kidneys, because they set numbers for you for which they try to work towards to reach those targets and then keep you healthy. But by and large, most of the management and control is actually in the hands of the patient.
Mm-hmm. So. Now, let me ask you, are there tests to check for heart disease? If somebody wanted to go out and make an appointment, what tests are done to check to see if one may have heart disease?
Oh, that's good. Well, if first of all, you have to go to your physician Two, the physician may likely request or order for blood tests to be done, especially if, of course, you're going to assess your risk for the heart disease. Probably look for probably contributing risk factors for you, and then of course he's going to look at your blood sugar level, blood pressures to be check, cholesterol levels will check, probably order for EKG to be done, and if you recover anything, you can go out to do echo to be done. So, and any other tests will depend on whatever that probably must have seen from this first level of test or any of the physical exam that the physician must have done on you. So, but basically, it's just blood tests to looking at your kidney numbers, looking at cholesterol levels, looking at your kidney numbers, and then EKG. These are the basic that likely be done. And then any other test will depend on whatever they find, either physical examination or further on those primary tests which I've just mentioned.
Okay. I have a question from an online question that was sent in by email. The person says, my potassium was 6.2. The nurse at Renal Care did a potassium shift. My sugar went down to 2. My potassium is now 3.2. I have muscle fatigue at the moment. What do I need to do to get me feeling good again? My GFR is 20. I don't want to go for dialysis. I did hear the nurse mention hypokalemia. Can I have high potassium foods to increase potassium to 3.5?
Yeah, I think if most likely that patient probably had hyperkalemia initially, and then there was emergency intervention, probably with insulin, and then they do what we call potassium shift. When they do a potassium shift, you have to realize that the total body potassium has not changed. All they've just done is to shift, because they shift the potassium from outside the cell into the cell. So if you don't take steps to reduce the potassium level, after some there will be a rebound, and then the potassium will, of course, will still go back to the outside the cell, and the levels may go up. I think this, for this patient, what they do is to find out why the patient probably have sudden high potassium levels that will require this emergency intervention to shift the potassium. It could probably be diet, taking high potassium diet. It could probably maybe some medications that can also increase potassium. And so that if it's diet, then they have to look at the diet, to work with dietitian to see how they can prevent the hyperkalemia. But in the potassium of 3.2 is not bad. With a slight dietary modification, they can bring it up to above 3.5, which is the safe normal level. But if you have to be very careful, because what the intervention they've just done for this patient is just a shift. The potassium have not been moved out of the body. The total body potassium remains the same. So if you give maybe a little time, there might be a rebound of that potassium. So they have to be careful. But it's to identify why the potassium went up. So if they find out that probably is drug, then of course the physician has to look at how he can substitute the drug that probably may be responsible for the hyperkalemia that warrant such emergency intervention. If it's diet, then of course he has to work with a dietitian to see how the high potassium diet could be reduced. But in the interim, 3.2, probably what they just need is just a dietary adjustment. And they probably bring it up to about 3.5 the levels is not so dangerous that will require a potassium intervention supplement to bring it off suddenly.
Okay.
Dietary, but now also you have oral tablets of potassium, which can be given. If it's dangerously go down to certain levels to below 3, then of course it will require parenteral potassium intervention.
Okay. Okay. Before I ask the next question, let's talk a little bit about what you do, because you mentioned about biochemistry and probiotics. How does the gut play an active role in the overall health? When we talked about the gut and how it plays an active role in your overall health, can you talk about that and the role of probiotics?
Yeah, thank you. Until recently, people thought that the gut has no role in promotion of diseases. But research over the years have found out that we human beings harbor bacteria in our gut. And these bacteria, is so much that they found out that the bacteria is so vital for the survival of the host. They carry out a lot of things. They involve in our immunity, involve in vitamins production, involve in immunity regulation, and inflammation, and also in many other metabolic activities, which before now we did not know. I've also found out that in certain disease conditions, there are changes that these gut organisms, microorganisms undergo, either to alleviate or to worsen the disease conditions. And this also applies to many diseases, including chronic kidney disease. And what we have found out that if we look at the traditional risk factors for chronic kidney disease, like hypertension, diabetes, and also what leads to the progression, they've looked at them. There are a lot of interventions and medications that are available to combat those risk factors. Yet, not much has changed in terms of reducing the incidence and prevalence of chronic kidney disease. And so research has been looking at other risk factors and other areas where probably it could be linked to why the CKD, despite all the interventions, that things are not getting better. And the gut is one of the areas that we discover that once a chronic kidney disease occurs, the gut microorganisms undergo some changes. Now, let me tell you about the gut. If you look at the human cells and gene, human cells probably is about 300,000, maybe 20 to 30,000 genes. But we harbor microorganisms in our gut that almost about 10 trillion to 13 trillion, almost 300,000 genes. So we found out that we are harboring more genes and microorganisms more than our own cell. This is based on the Human Genome Project. And we found out that in chronic kidney disease, these organisms undergo changes. In health, these organisms are responsible for digestion and also elimination of waste products, because the food we eat, not all of them are digested. And most of those proteins are digested by these microorganisms. And these microorganisms, more or less, most of nitrogenous waste are also eliminated by these microorganisms. They use them as food, digest them, and then we pass them in our daily bowels opening or stools. What happens when the kidney fails? Most of this nitrogenous waste that is generated, most of them supposed to be eliminated by the kidney. But when the kidney fails and the kidney cannot eliminate them, then they accumulate in the body. And this is one of the reasons why kidney progression, goes fast. And it has also been found out from various studies that if you can introduce a healthy bacteria, restore the balance of these microorganisms in the gut, you reduce the nitrogenous waste, reduce the pressure on the kidney, reduce the inflammation and the immunological problems, and also the gut integrity and gut that is also disrupted, that you restore this. And the patients, those who have this chronic kidney disease, the progression slows down, they get better, quality of life is also good. And this is as a part of clinical development of Kibo for the past 25 years. And they're able to come out with carefully selected microorganisms that can, eliminate this nitrogenous waste, especially in people with chronic kidney disease, and reduce that progression. In fact, sometimes it has been shown that it reverses even the declining kidney function. And it has been shown to also improve a lot of quality of life in most of these patients, and also improve their symptoms. So what Kibo is trying to do is, with this carefully selected probiotics product, if you add it to the current therapy, we think that it will help a lot in most of these patients with chronic kidney disease.
Wow. Now, with that, we had a question, I guess, with COVID and everything going on, and we heard about the triple threat viruses, RSV, flu virus, and COVID. Have you seen in your studies efficiency in using these biotics following COVID infection or COVID vax, since both compromise many organs, including heart and kidneys?
Yeah. The one thing about probiotics, they are found in various organs. The gut harbors more than 90% of the probiotics. You can find it in the skin, upper respiratory tract, in the lungs, and in your genital tract. And the probiotics have been used also but the main probiotics used mainly is in the area of gut health. And recently got into kidney health space. Of course, also into brain, sleep, and all those things have been linked to probiotics, because these macronutrients secrete a lot of chemicals, hormones, and other things that affect various organs, including the brain. So for respiratory infections, for which COVID, RSV, and other things belong to, there have been some studies that show that some probiotics improve the immunity of people who suffer from this upper respiratory tract infection, RSVs, flu, and as well as COVID. For COVID, there have been studies during the pandemic that's able to show that certain people who were given the probiotic strains, especially the lactobacillus strain, also shortened their symptom duration, hospitalization is reduced, and some of the complications are reduced, especially the modulation of immunity. because one of the problems that people with COVID during the pandemic and the early era they suffer was what we call the cytokine storm. And how do you modulate that immunological reaction of the host to the virus? So if it's like immunological overkill, and probiotics, part of the mechanism of action is the modulation of immunity, and it reduces that overreaction of the host to the virus. And of course, that it has been shown that it's certain people, this reduces those cytokine storm. So application of probiotics in respiratory infection is, has been demonstrated in certain cases. And COVID, they've seen some beneficial of COVID, of the probiotics, certain stress, especially lactobacillus in there. But for gut, it's well known that, chronic diarrhea, irritable bowel syndrome, so often colitis, they've seen some benefits in them. And especially infantile diarrhea and other things. And that's why you see that lactobacillus and other things are there. And one other thing is that, of course, probiotics have been shown to be generally safe. And so it use. And of course, antibiotics induce diarrhea, especially due to Clostridium difficile. Probiotics is now one of the standard treatment, which have recently been approved by FDA for use. And of course, we in Kibo, by the time we finish with our current clinical trial, then of course probiotic will likely come into the kidney health space as well. So there's a wide range of applications of probiotics in various disease conditions. But so if you hear probiotics, can have probiotics in kidney health, gut health, probiotics in brain, probiotics in sleep, probiotics also in skin dermatology, probiotics in women health. So now increasingly research has shown that most of the diseases are connected to the gut health, to the gut microbiome, and so
Okay.
the question is, how do you know which of the microbiome that is specific for each disease? It's not a question. It's not all size fit all. You have to identify the specific microorganisms that is targeted for the various disease conditions.
Got you. Dr. Ntia, I know that your specialty is kidney disease and not cardiac, but we had one question from Berea Watt, and they asked, I had an ablation of the heart to stop episode of SVT, and I have a GFR at 19. My question is, will the SVT still be present because of my kidney disease? This is another question where you had the heart and the kidneys connecting, and I guess they want to know will the SVT still be present?
Supraventricular tachycardia, yeah.
Will they still continue to have that because of the kidney disease?
Yeah, the supraventricular tachycardia, which is an arrhythmia.
Oh, we lost you, Doc.
Can you
there
hear
we
me
go.
now?
Yes.
Okay. So the person has SVT, has an ablation. Now, of course, he also has he also has chronic kidney disease, the GFR of 19. So what he needs to do is to ensure that the control of the heart condition is maintained to prevent the progression of the chronic kidney disease from the GFR falling to below 15, because by the time the GFR falls to below 15, then of course they have to start discussing renal replacement therapy. So the key to maintaining the kidney function is to ensure that the heart condition is well looked after, is well cared for. So the SV, the other thing again is, as the kidney function get worse, the heart condition is likely to get worse as well. Because with somebody with SVT, any electrolyte disorder can trigger it. So this he has to know. I mean, so this patient is supposed to, work closely with his cardiologist to ensure that he remains in a steady state.
Okay. Doc, I want to just ask you one more question before I get to the last part of the interview. And this gentleman, we know kidney disease affects patients in different ways, and there's a lot of symptoms come out of undergoing kidney dialysis. Now, again, this is dealing with the gut. This one person says, why do one's stomach always hurt after eating when on dialysis? What medications can be taken, which he can't recommend, but what medications can be taken to help this Alka-Seltzer, or what can be done? Thanks. And I don't think he can answer that about medication, because you could have something else going on. But just to chime in, isn't it a medical opinion that one should eat or not on dialysis? Because it's often recommended that one should not eat while undergoing treatment because of the digestion process.
Yeah, absolutely. Because, I mean, if you're on dialysis, I mean, you have to be very careful about eating. I mean, because they are prone to nausea, prone to vomiting, and so because of the likely hemodynamic changes, blood pressure can, your blood pressure can drop, and all those things intradialysis, and that can trigger vomiting, and they don't want you to, vomit and then inhale, some of the food. In dialysis, what probably they may allow is just, little fluids, beverages, maybe mild, but we try to avoid eating during dialysis as much as possible. In terms of which medications, of course, the physician caring for you will probably recommend either antacids or proton pump inhibitors, depending on the severity of your pain. I think the physician will assess it, and then he will recommend the appropriate medications to control it. Sometimes we don't even need any medication. It's just this simple advice of avoiding eating during this, and then look at any of the foods that you think that triggers your symptoms. If you can avoid it, you avoid it. But by and large, the physician will assess the probably cause, severity, and if you think that you will need any medical or medication intervention or not.
Okay. Now, one product that's new to Kevo Biotech, which I just want to briefly discuss, is the Kevo Cardio Support, which I've been taking it. But can you briefly share with the audience exactly what this product does and how it could be beneficial to one's treatment plan if they're treating their heart disease or kidney disease?
Yeah, this is a formulation that contains probiotic, prebiotic fiber, for what we call functional fiber, and also has some minerals that are specifically good for cardiac function, coenzyme A, some vitamins, and then of course, if you look at one of the important combination of the probiotics and the prebiotic fiber is that the prebiotic fiber, or what the prebiotics or the functional fiber, promotes, growth of the good bacteria in the gut. And we know that, the gut microbiome also has to do with cholesterol metabolism, also has to do with insulin, has to do with blood sugar control, also has to do with weight control. Okay. Then, of course, some essential vitamins also production. So if you look at the mechanisms of action of the combination of these ingredients in the Kibo cardio support, is geared towards reducing the risk for cardiac disease, cholesterol, insulin sensitivity, or reduce obesity control, vitamins, and then the addition of minerals that are specific and good for cardiac function is also in combination. So they come out with this specific, knowing fully well that look, once the heart is not working well, the kidney is not likely to work well. So this is so good for people who have chronic kidney disease and as well with some cardiac complications or heart complications.
So the Kibo cardio support in conjunction with proper nutrition, maybe addition to exercise, weight management, and other possibly medication regimen can be a beneficial addition to helping them reduce or to manage heart disease and kidney disease?
Absolutely.
Wow. Okay. Well, Doc, we're down to the time, but before you go, what do you want people to know that are at risk for heart and kidney disease as a physician and director and medical office of a biotech company? What do you want individual to know, most importantly, before you leave this broadcast?
As we all know, Kibo, a company that is in the kidney health space, one of the message we want to get out to people there is kidney disease does not just suddenly happen, especially chronic kidney disease. There are risk factors that predispose one to kidney disease. And the only way you can know is, first, of course, form the habit of your annual physical. 2, live a healthy lifestyle, diet, physical. Try to get your weight down. Try to be active, physical activity, if it is in. Then, of course, if those who have the risk factors, especially diabetes and hypertension, which are the 2 big risk factors for both kidney and heart disease, ensure that you get all these conditions well controlled. Work with your healthcare provider, with your physician primary care, with your dietitian, and of course, we also recommend that apart from healthy diet, then you need also some replacement therapy, supplementary add-on, like the Renadil, which we have, which anybody from early stages of chronic kidney disease to the late stages can take, because with evidence, we have data to show that is relatively very safe. And of course, by the time we finish the ongoing clinical trial and bring out the data, it will clearly even demonstrate the beneficial effects of adding a product like Renadil to your current standard of management of those who have CKD. So my takeaway for people who are watching is, for chronic kidney disease, the best way is primary prevention. Secondary prevention involves ensuring that you control the risk factors for which has predisposed you for chronic kidney disease.
Okay. Well said. Okay, Dr. Antia, thank you so much for taking the time out of your busy schedule to come on and discuss the heart-kidney connection. Look forward to having you back in the future to discuss more important topics relating to the kidney disease community.
Thank you, Steve. Thank you for having me.
All right, so take care and we'll talk soon.
Thank you.
All right, thanks, Doc. Bye-bye. So, guys, look, let me say something. This was a great program, and a disclaimer that I forgot to make is that these products, Kibo, Cardio Support, and the Renadil product here have not yet been evaluated by the FDA. So these products are not intended to treat, cure, or diagnose. So we just want to get that disclaimer clear. However, these are some great products. I'm a user of Renadil myself with stage 2 kidney disease, and I've been very happy with this product. I've seen my GFR go from 80 to 87, and that's with addition to proper nutrition, exercise, and medication regimen. So I am extremely happy with this. If you're interested, we have the link, or you can go to the link in this ad, and for a discount, use the coupon code here, Steve the Kidney Nurse. If you're interested, we'll leave this up for a second. But you heard Dr. Antia talk about the importance of gut health and how probiotics are a beneficial to the addition of what you're doing now with your regimen. So definitely, if you're interested, go do your research at www.renadil.com. And also you have the Kibo Cardio Support. So with that being said, guys, thank you for joining this broadcast. Be on the lookout for more educational broadcasts right here on the Urban Health Outreach Media Network. Have a good night. Stay safe. Don't forget to mask up. It's really getting bad out there. And be careful. Have a great evening, everyone. Good night. Got to do my intro.
Warriors around, don't get caught in the mosh pit. Fuel to the fire, ain't nobody can stop it. Trouble in my city, but you know I'm across it. Got a 40 on my hip and I'm liable to spark it. Throw down these hits, my click is indivisible. I aim, you duck, I squeeze, now you invisible. I'm not afraid of getting physical. All these different chemicals are fogging up my visuals. Bloods on my hands, got slugs on my gunners. Yo, we notorious, we ain't no runners. Bloods on my hands, got slugs on my gunners. Yo, we some warriors, they ain't called gunners. Bloods on my hands, got slugs on my gunners. Bloods on my hands, got slugs on my gunners. Put on my strap, put on the beat, put on the map, put on my team. Take out every motherfucker in between. Know what I mean? Better myself, better my aim, better my rap, better my name. Killing rappers on my hang, I'm by their chains for the fame. Never thought I would it, now I'm running. You don't wanna follow me, I'm like the